Hello and welcome, Ms. Nurse Eunice with Florida Training Academy. And in today's video, we're going to review CPR and first aid questions. So I'm going to give you all about 10 minutes to log on and join me. Again, this is Nurse Eunice, and we'll get started shortly. Hi, everybody. And so happy Father's Day to all the fathers, uncles, mentors. I hope you all are enjoying your weekend. And let's get started in 5 seconds. All right, here we go. Question number 1. What is the first step you should take when you see someone has collapsed? Is it A, start CPR immediately, B, call 911, C, check for responsiveness, or D, give 2 rescue breaths? And if this is your first time joining us, be sure to go ahead and get pen and paper. You're going to learn a lot. And my goal is for you to not only be more comfortable with performing CPR, using an AED, and also performing some first aid skills, but it's to also help you prepare for those exams that you're going to have to take so you can ace them on your first try. So, revealing the answer in 3, 2, and 1. We have a lot of C's. And C is the correct response. Whenever you see someone who has collapsed, the first thing you want to do is check for responsiveness. That ensures the person truly needs emergency assistance. Not everyone's going to need CPR. Not everyone's going to need for you to call 911. Some people just need you to be there. And so, based on how they respond, you'll know if you need to call 911. If they're unresponsive, definitely call 911 and get emergency help right there. Number 2, what is the correct compression to ventilation ratio for adult CPR? Is it 15 to 2, 30 to 2, 2 to 30, or 15 to 1? And I see a lot of familiar names. Hello, everybody. Good afternoon. I see B's, I see C's. And so if you selected B, great job. So the correct response is for CPR and for an adult victim, the correct ratio for adults is 30 compressions followed by 2 breaths. And so we stated as 30 to 2. Number 3, how deep should chest compressions be for an adult during CPR? Is it 1 inch, 2 inches, 3 inches, or 4 inches? We're doing those chest compressions. How deep do we compress? Revealing the answer in 3, 2, and looks like everybody got the correct answer, which is 2 inches. So this is what I want you to think of. Whenever you're compressing on someone's chest, if the side view of their chest is a normal size, so this is not a person who is obese, you want to compress 2 inches. Bring that chest about 2 inches in. So yes, there's a possibility that you can crack ribs, but right now we're going to sacrifice those ribs because if we don't get past the ribs and compress on that person's heart, we're not going to provide blood flow to vital organs. So for a normal sized person is 2 inches. A good rule of thumb is 1/3. So whatever that side view of the chest is, if you're on a bariatric unit with obese patients, whatever the side view of that chest is, bring it in 1/3 of the way. But for your test, 2 inches or 5 centimeters will also be an appropriate response. Number 4, which of the following is not a step in using an AED or an automated external defibrillator? A, turn on the AED. B, apply pads to the patient's chest. C, turn the AED off after delivering a shock. Or D, follow the AED prompts. Which is not a step? Great job, team. Everyone chose C, so you are so smart. Turning off the AED after it delivers a shock is never appropriate. So you're going to continue your chest compressions while the AED is on and the pads are in place. Remember, the AED is voice guided and it will know to reanalyze the victim's heart rhythm every 2 minutes, which is why we should leave it on, because it's going to help us provide resuscitative services or skills to this person until those advanced providers get there. So it's voice guided. You turn it on, follow the prompts, and keep it on until someone with no more experience takes it off. All right, and so this is an example. So the pads are still on. We're going to continue doing our 30 compressions, followed by our 2 rescue breaths without ever turning off the device and without removing the pads. Number 5, in CPR, how often should you switch with another rescuer to avoid fatigue? Is it every 1 minute, every 2 minutes, every 5 minutes, or every 10 minutes? How often do you want to switch off? And I hope you all are having a fantastic weekend. I'll reveal the answer in about 5 seconds. So I'm looking for new responses. I see someone said every 5 minutes, which was C. Paula says every 2 minutes. And so here we are in 3, 2, and 1. We have to switch off every 2 minutes or 5 cycles. So that's where some of you all were choosing a 5. So after 30 compressions followed by 2 breaths, we repeat that process 5 times, which should take about 2 minutes. So you want to switch compressors every 2 minutes if you have help. That minimizes the fatigue and also make sure that the victim is receiving effective chest compressions. Number 6, what is the primary purpose of chest compressions during CPR? Is it A, to move blood to vital organs, B, to restart the heart, C, to clear the airway, or D, to warm the body? Why are we providing high quality chest compressions? I see a B. Any other responses? I think I see a C. I see a B. And this one was tricky for you all because this response is not B. The reason why we perform chest compressions is to move blood to the vital organs. Remember, you're being this person's external heartbeat. And so if we don't compress deeply enough, we're not going to send blood to the brain. We're not going to send blood to the lungs. So whenever you are externally performing chest compressions, you're helping to restore blood flow. The AED restores the rhythm. CPR maintains blood flow. Number 7, which pulse is checked in an unresponsive adult to determine if CPR is needed? Is it the radial pulse, brachial pulse, carotid pulse, or femoral pulse? Oh, I see a lot of correct answers, everybody. I'm so proud of you. The correct response is carotid pulse. Okay, so let me tell you why I chose this image. At no point should you be palpating both carotid pulses at once. If you do, you are stopping blood flow to someone's brain. So you'd only palpate one carotid artery at a time. This person is, of course, looking at you, looks like she's responsive. So if they are able to respond, you would go for their radial pulse. In an emergency, you go for the carotid pulse. And again, you only go for one because if you occlude both, you're cutting off the blood flow to the brain. But the carotid pulse is the most reliable pulse to check in adults. Another reason we check it is because it's the closest to the heart. So if a person is unresponsive and possibly in a cardiac arrest, you don't want to be feeling for distal pulses, such as the ones in the wrist, the ones in the groin, or the ones in the feet, because the body's going to shunt. It's going to force blood flow up to the brain. It's going to try to save the most important organs. Number 8, when performing CPR on an infant, where should you place your fingers during chest compressions? A, 2 fingers on the center of the chest. B, 1 hand on the center of the chest. C, 2 hands on the center of the chest. Or D, 2 fingers on the upper abdomen. I see B's, I see A's. All right, we're going to go with A because so many of you all chose that as the correct response. And the image I have here does not show the exposed chest, but you would expose the chest and place 2 fingers on the center of the chest, and that's how you perform CPR for an infant. And for most guidelines, an infant is from age birth to puberty. If you're dealing with like neonates, the ones who are still in the hospital, that's an entirely different course. So for most American Heart Association purposes, if the child is less than 1, you still consider them to be an infant. Number 9, what is the recommended rate of chest compressions during CPR for all age groups? Is it 60 to 80 compressions per minute, 80 to 100, 120 to 140, or 100 to 120? Anna says D. Tamika says D. Wesley Sniper says D. Navalette, Paula, is so many of you all who chose the correct response. That is right. We have to be faster than our heart. So if a normal heartbeat is 60 to 100 beats per minute, we are not as effective. We're on the outside of their chest trying to compress. So we want to be a bit faster. And the correct response is 100 up to 120 compressions per minute. And that ensures effective compressions and circulation. Number 10, in a choking infant, what is the first intervention you should perform? Is it A, give abdominal thrust, B, perform back blows, C, start chest compressions, or D, call 911? And if this is your first time here, I'm Nurse Eunice. I would love to be your nurse educator between business development, CPR, CNA, ACLS, PALS. This is what I do. It is my passion, and I love making sure that you all have what you need to not only pass your tests, but to help others and to do so safely. And so I see B's. I see a lot of B's. I see a D, and here is the correct response. Whenever you have a choking infant, try to get it out. So the best response is to perform the back blows. Don't pick up your phone and call 911 immediately, because if you place that infant on your arm with their head lower than their diaper and you hit between their shoulder blades 5 times, chances are you can clear the obstruction. So make sure the head is lower than the diaper so gravity can assist you in clearing the baby's airway. And then if you need a video on how to help a choking infant, if you go to our website, which is showing below, fltraining.com, you can download our free CPR and AED study guide. And whenever you open that PDF file, it will link to our videos that show you how to help a choking infant, how to help an adult who needs CPR. So we have additional resources for you to make sure that you're able to safely care for people and those who you love. Number 11. Oh, let me go back. If you are unable to clear the airway, that is when you call 911. So if that baby becomes limp, a choking infant becomes limp, you lay them on a flat surface. Of course, put your cell phone on speakerphone. You're going to call 911. And if at any point someone who is choking becomes unconscious or unresponsive, you start CPR. Number 11, what is the correct sequence for using an AED? This is a lot. I'm not going to read it to you. I'll just look for your responses. What is the correct sequence for using an AED? All right, I see D's, I see B's, I see another B, I see another D. So it is a definite toss up between B's and D's. So I will reveal the answer in about 5 seconds. Yes, if you chose D, you check for responsiveness first because if the person's talking to you, you don't even need to turn the AED on. So D is the correct response. You want to check for responsiveness, turn on the AED, which talks to you. It will tell you to apply the pads. And after it's done analyzing, if a shock is needed, it will tell you to deliver the shock. We always want to, number one, if appropriate, if it says it in a test question, we want to check for safety, scene safety. And then the second thing we want to do is check for responsiveness because not everyone who is not responding to you, not everyone needs CPR. Some people just need some stimulation. Number 12, which of the following is the correct hand placement for chest compressions in adult CPR? Is it one hand on the center of the chest, two hands on the center of the chest, two hands below the rib cage, or one hand below the rib cage? This is for an adult. Someone who's reached puberty. How many hands and where do you place them? I did not expect for Chrissy, Paula, yes, we can, Latanya, Marachi. I did not expect for anyone to get this wrong. So if you chose B, two hands on the center of the chest, you're absolutely correct. So you're going to place one hand on top of the other. And some of you are like, oh my God, my right hand's stronger, my left hand's stronger. Which do I put down? Look, just put a hand down and start compressing. If it doesn't feel right, you can always switch. It doesn't take you that long to switch. It takes about a second. So I don't want you trying to figure out which hand should you lead with. Lead with your strong hand. If that doesn't feel good, just switch it out. And don't forget that after about 5 cycles or 2 minutes, if you're exhausted and there is help there, you can always ask someone else to take over the compressions. Number 13, when should you stop performing CPR? When the person shows signs of life, when another trained responder takes over, when you are too exhausted to continue, or all of the above? It's like we have Kimberly, we have Wesley, we have Gigi, we have Afia, we have Paula. If you chose D, you are absolutely correct. So we're going to stop our CPR when any of these occur. If the person shows signs of life, they don't need chest compressions. When someone else with more experience, the paramedics, the rapid response team takes over, you would stop your compressions because they are now the leaders. And believe it or not, let's say you're in the woods, help is not coming. If you become too exhausted, the Good Samaritan law is going to protect you. You can also stop CPR. So the correct response for this is D, all of the above. And my explanation says, CPR should be stopped if the patient shows signs of life. But the reason that I have this image of the recovery position here is because we don't want this person aspirating. They may vomit after we call it ROSC, after they achieve ROSC, after they start breathing again on their own, after their pulse returns. They may vomit. So after you stop CPR, don't leave them on their back. If you're in the hospital, of course, you have beds that can elevate. But if you're not in a hospital, you're going to turn them onto their side. That is the recovery position. And so my note beneath the image states the recovery position after CPR is for those with signs of life. But let's continue. You'd also stop whenever someone who has more training than you can take over, and you stop if you are too exhausted to continue. And so, usually in a facility, after about 10 minutes of us performing CPR on an adult victim, the physician will pronounce death. We'll say they called the code, because after about 10 to 15 minutes, I don't care how good our CPR is, there's not enough oxygenated blood going to that person's brain, and they may end up brain dead. So that's why we will call a code in the facility. That information wasn't listed there, but that will be another reason why we would stop our CPR if a doctor tells us to do so. Number 14, what is the recommended depth of chest compressions for children? Is it 1 inch, 1.5 inches, 2 inches, or 2.5 inches? And a child is from 1 to puberty. How deeply do you want to compress on a child victim? I see A's, I see B's, I see A's, and they have simplified CPR, everybody. So an adult and a child is the exact same depth. So it's 2 inches for an adult, and it's also 2 inches for a child. So the correct response is going to be C. The difference is when you are performing CPR on a child victim from ages 1 to puberty, so that's a developmental stage. Maybe you have a overweight child, or you have a child with breast bud development. You're going to use 1 or 2 hands. My rule of thumb is to go ahead and use 2 hands, because as a rescuer, if you decide to use 1 hand on a child and that child doesn't make it, forever, for the rest of your life, you're stuck with thinking, what if I would have used 2 hands? Maybe I didn't go deep enough. So I highly recommend that you use 2 hands on a child versus just 1 hand. And that is the common or the current recommendation from the American Heart Association. If you don't know whether or not you're getting 2 inches with 1 hand, just go ahead and use 2 hands. Number 15, what is the first thing you should do if someone is bleeding severely? Do you apply a tourniquet, call 911, apply direct pressure, or clean the wound? Let's see what you all have. I see C's, I see A's, I see B's. I see so many C's. I'm just going to reveal the answer. So if you chose C, apply direct pressure, you are correct. You're going to, if you don't have gloves, you can use a plastic bag. You're not supposed to use cloth, because blood can actually penetrate through the cloth, and that'll put you at risk of developing a bloodborne pathogen. So either with a plastic bag or your gloved hands, you're going to take a cloth, whether it's a t-shirt or a gauze, and you're going to apply it onto the injured site and press down until you can control the bleeding. If that does not control the bleeding, that is when you'll, of course, call 911, and then you can go to another technique, such as putting a tourniquet on the person who's bleeding. Number 16, in the case of a suspected spinal injury, what should you do? A, perform the jaw thrust maneuver to open the airway. B, move the patient to a comfortable position. C, tilt the person's head back to open the airway. Or D, apply a neck brace. So someone has injured their spine. What should the rescuer do? Oh, you all are everywhere. I have B's, C's, D's, B's. It's a toss up. So it looks like for this one, I'm teaching you something new, and I'm teaching you something that we don't do a whole bunch of. But looks like I have a correct response. A munchery, you have it. Great job, dear. We're going to do A. We're going to perform the jaw thrust maneuver to open the airway. And so this is not something that's taught a lot unless you've taken first aid, but the jaw thrust maneuver opens the airway without moving the spine, thus reducing the risk of further injury. And so you want to tilt the head by lifting the jaw versus bringing their head all the way back and risking further injury to their spine. But I have a note here beneath the image. If the only concern is spinal injury, you can do the jaw thrust maneuver. However, if this person's in cardiac arrest, we do not focus on this technique. If you do not have help and the victim is in cardiac arrest, the jaw thrust maneuver is not recommended. You will perform CPR without modifications. And the reason for that is it's going to take you longer than 10 seconds to go from that person's chest, to go to the head of the victim, lift their chin, and to give those 2 breaths. Current standard CPR, you only get to take your hands off the chest for 10 seconds. That is it. So this would not be the technique you'd use if someone is in cardiac arrest with a spinal injury. You'd continue doing CPR the way you were taught until those advanced responders come. And when the paramedics come, they would use this technique, but they also use bags to ventilate, to give breaths. Number 17, which technique is recommended for relieving choking in the responsive adult? Is it A, back blows, B, rescue breaths, C, chest compressions, or D, abdominal thrust? A responsive adult, how do we help them if they're choking? Paula, Uzoma, Mary, Alaraki, I hope I pronounced that correctly. You all are correct. So it is the abdominal thrust, formerly referred to as the Heimlich maneuver. Look, the Heimlich family sued, not Dr. Heimlich, but the Heimlich family sued. So we can't really say the Heimlich maneuver, which is why you will hear us saying the abdominal thrust. But you're going to form a fist. You're going to place the thumb of that fist above the victim's belly button. You're going to cup with your free hands, and you're going to do upward and inward thrust until the object is expelled or the person can talk freely. If that doesn't happen, then the person's going to become unresponsive, at which point you will lay them on the floor, of course, call for help, and start CPR. So abdominal thrust until the object is expelled is what you would do for a choking adult. Number 16, how should you care for a burn that covers a large part of the body? A, apply ice directly to the burn. B, break any blisters that form. C, cover the burn with a clean, dry cloth. D, apply ointment to the burn. Don't think about what you do at home. Don't think about what grandma does. Think about what current practice would allow you to do. So we're not putting butter on the burn. Yes, everybody. Yes, it is C. And so I didn't like this question, so I had to add to it. It says cover the burn with a clean, dry cloth. We need to cool the burn first. So if you don't have running water, but you have a bottle of water, you can pour a bottle of water onto that burned area. So first we're going to cool the skin with cool running water, not hot water, not cold water, room temperature or cool water. And then afterwards, you can cover the burn with a clean, dry cloth. That's going to help prevent infection and further injury. And of course, if a burn is ever on the face, neck, chest, hands, feet, or groin, especially if it's an adult or infant, you have to get them to the hospital. They have to be seen emergently. You don't want to try to treat these at home because an infection could form. And of course, the skin is the largest barrier. So once the skin is open, an infection can form and this person can become septic. So you want to get them seen right away. Number 19, what is the first step in treating a suspected fracture? A, call 911. B, move the injured area to check mobility. C, apply heat to the injured area. Or D, immobilize the injured area. Everybody has the right answer. So, yes, it is D. We want you to immobilize the injured area. Immobilizing the injured area prevents further injury and pain until medical help arrives. And this is what I want to say about that. In the image, it shows someone who has a sling on. It also shows somebody who has a gauze or ace bandage on their foot. I want you to know that whatever you put on this person, the paramedics is going to take off. So if you can put a purse or something under their arm, if you can put a jacket under their arm to immobilize it, less is more, because anything that you took your 5 minutes to put on, as soon as the paramedics get there, they're going to cut it off because they have to be able to see the extremity so they can determine whether or not there is a fraction. So in most counties, districts, we just keep them comfortable and the paramedic will come and immobilize it with a sling or a splint. Number 20, if someone is having a seizure, you should A, hold them down to prevent injury. B, place a soft object under their head. C, give them water. D, insert a bite block or something into their mouth. I know this one's tricky. We have B's, we have D's. It is a toss up. We even have a C. So when someone is seizing, they don't have control of their movements. Their brain is just rapid firing. You don't want to put anything in their mouth. They're not going to bite their tongue. They're not going to swallow their tongue. As a matter of fact, whatever you put into their mouth is going to cause more injury internally in their mouth. But what you do want to do is you want to protect their head from hitting the ground, from hitting the concrete. You're going to place a soft object under their head. If you are a CNA who works, or a nurse who works in a healthcare setting, we'll ask you to pad the rails. That way, if a person is thrashing about because they're having a seizure, they won't injure themselves on the side rails. But because there's usually a pillow under their head, you don't have to pat their head or put anything beneath it in a hospital setting. So it just depends on where the person has the seizure. And so there's the answer. B is for question number 20. And let me just hide this banner. And so seizure first aid, number 1, do not panic. If you can, turn them onto their side. And I need for you to start timing the seizure. That's important, because if a person has a history of epilepsy, usually the doctors are not concerned until the seizure has gone on for longer than 4 to 5 minutes. 4 up to 5 minutes. So you start timing as soon as you start seeing seizure activity, because a person who has epilepsy is going to seize. That is part of their diagnosis. If the seizure goes beyond 5 minutes, usually there's an emergency medication that your nurse can administer. So you're going to time the seizure. You're going to stay with the resident, whether it's a child, adult. You're not going to restrain them. You're not going to put anything in their mouth. You're going to put something soft under their head, as I stated before, in case they're hitting the ground, thrashing about. Don't put anything in their mouth. If you're in a home care setting, you're going to call 911. If you're in the hospital, you're going to press that code button so that you can get your nursing team and the rapid response team in to help you. Number 21, what should you do if you suspect someone is having a heart attack? Is it A, make them lie down and rest? B, give them water to drink? C, call 911 and have them chew an aspirin? D, perform CPR immediately. And so this isn't about your title. This isn't about your location. You are in a home care setting and someone is exhibiting symptoms of a heart attack. You call 911 and they're going to ask you questions and give you duties to perform. What do you think the duties would be? Yes, it is going to be C. They're going to, after you call 911, they're going to ask about the symptoms, ask if the person has an allergy to aspirin. And if they do not have an allergy to aspirin, they're going to ask that you give them an aspirin to chew because aspirin thins the blood, which is going to help the blood get beyond the blockage, which is why this person's having chest pain. So calling 911 and administering aspirin can help to reduce the severity of a heart attack while you are waiting for the emergency service vehicles to come. If you're in the hospital, your nurse should already have, they call them telemetry protocols. They're going to have protocols in place to where if a person starts complaining of chest pain, they know to call for an EKG. They know to get aspirin and nitroglycerin. So this is more of a concern if you're outside of a hospital facility. Number 21, what should you do if you suspect someone is having a heart attack? We just did that one. Let's go beyond that. Number 22, for a nosebleed, you should A, tilt the head forward and pinch the nose, B, tilt the head back and pinch the nose, C, apply ice to the back of the neck, or D, below the nose forcefully to remove all the blood and the clots. What do you think the best response is if you have a resident with a bleeding nose? I see a lot of A's. I see a B, I see a C, but the correct response is A. You're going to pinch the nostrils and then have the person lean forward. The goal is for them to spit the blood out of their mouth. If you have them pinch their nostrils and hold their head back, they're going to swallow the blood. So we need the blood to come out. Usually a nosebleed is more of an inconvenience. It is not a medical emergency. We can cool them off by putting an ice pack on the top of their nose. We can, on the bridge of their nose. Or if you're at home, you can put maybe some frozen vegetables on the bridge of their nose. For kids, usually they've been in there digging around, or maybe it's due to a sports injury. So they may need, especially if you think it's injury related, they may need to go see the doctor. For an older adult, it could be because the oxygen is drying out their air passages. And so the nurse would ask for humidified oxygen from a physician. Number 23, when should you use the recovery position? A, when the person is unresponsive and not breathing. B, when the person is unresponsive but breathing. C, when the person is having a heart attack. D, when the person is choking. When do you place someone in the recovery position? I see A's, I see B's. I see a lot of B's. And so, team, great job. You want to put someone in a recovery position when the person is unresponsive but still breathing. You don't want to put someone in a recovery position if they're not breathing. You want to be starting CPR, or at least start providing those rescue breaths. So for the recovery or the side lying position, it helps to keep the airway open and prevents aspiration in someone who can't communicate with you. So you want to turn them to their side. Please note that in the hospitals, our beds can go into different positions. We have suction equipment, so you won't always see us put someone in a recovery position in a hospital because our beds and our equipment allows us to do more. But if you don't have a specialized bed, if you don't have suction, I need for you to put that person on their side so they won't aspirate or their vomit won't go into their lungs. Number 24, what is the correct action for someone experiencing heat exhaustion? A, move them to a cooler environment and give them a cup of cold water. B, apply warm compresses. C, move them to a cooler environment and give them sips of room temperature water. Or D, give caffeinated beverages. I didn't trick not one of you. And I made this tricky thinking I could trick you, but obviously I was wrong because all of you all chose the correct response. It's going to be C, move them to a cooler environment, put them under a tree, take off those unnecessary clothes, and give them sips of room temperature water. You don't want to go from one extreme to another. So you don't want to give someone who is extremely hot ice cold fluids. Also, do not submerge them in ice cold water. You will make their body go into shock. So, moving to a cooler place and slowly rehydrating the person helps to reduce the body temperature and alleviate the symptoms. And if this is your first time here, go ahead and like and subscribe. Don't forget, if you go to fltraining.com, which is my website for Florida Training Academy, you can download these slides, but you can also download your free CPR and AED study guide. And so I'm sure at some point you're going to have a CPR or a BLS course, and we just want to make sure you're able to pass that course on your first attempt. Number 25, for someone suspected of having a stroke, what is the acronym to remember? Is it RICE, FAST, CPR, or ABC? What acronym do you remember when you think someone is having a stroke? Tamika says B. Farad says fast. So I am so proud of you, everybody. Everybody chose B. And if you don't remember, FAST stands for face, arms, speech, and time. So whenever you are thinking that someone is having a stroke, I want you to think fast. Look at their face. A part of it may be drooping. Maybe they are drooling out of the side of their mouth. It's asymmetrical. That would be a reason for you to call for help. You can also ask them to raise their arms, and one arm isn't going to raise because they have one side of their body that is weak as a associated with a stroke, excuse me. So that would be another reason for you to call for help. You're going to ask them to speak, and their speech may be garbled. So if their speech is slurred or garbled, or if they're confused, you would also call for help. And calling for help if you're in the hospital is calling a code. Calling for help if you're home care is going to be calling 911. And that is the T. Time for you to call somebody. So anytime you are thinking that someone's having a stroke, you're going to think fast. You're going to focus on the face, the arms, the speech. And if anything is abnormal, you're going to take the time to call for help. And you all, I'm going to miss you all. I have my home care client tomorrow, so I will probably be online a lot later, but I appreciate you. I thank you all so much. You all are wonderful. Thank you all for being lifesavers and caregivers. And again, this is Nurse Eunice with Florida Training Academy, and I'm going to try to come back on tomorrow night with a CNA exam prep video. So Thank you all. Remember, for my fathers, happy Father's Day in advance. Enjoy your weekend. And everybody, you're welcome. I'll see you next time. Bye.